Workers in New York City are setting up a field hospital in Central Park. The white tents will have a total of 68 beds, including 10 set aside for intensive care. A Christian humanitarian aid group called Samaritan's Purse is organizing the effort. CBS reporter Elise Preston joins us live from New York with more on the national outbreak as the U.S. nears 150,000 cases. Elise?
Alan, like the makeshift hospitals in your area and this one behind me, many are being considered across the country as a way to handle the unprecedented cases.
The Naval Hospital ship Comfort arrived in New York City ahead of schedule Monday to relieve the pressure on hospitals overwhelmed by the coronavirus crisis.
We are not alone. Our nation is helping us in our hour of need.
The Comfort has 1,000 beds and will treat non-coronavirus patients. Workers are also building an emergency hospital in Central Park near Mount Sinai Health System. The 68-bed field hospital will serve as a respiratory care unit.
These field hospitals are just the start. New York City's mayor says the city needs to triple the amount of hospital beds by May.
In Maryland, a drive-through screening location opened in the parking lot of FedEx Field. Maryland's governor issued a stay-at-home directive.
We are no longer asking or suggesting that Marylanders stay home. We are directing them to do so.
At one Maryland nursing home, 67 residents have tested positive, and more than 24 staff members are showing symptoms. The governors of Oklahoma and Texas say anyone traveling to their states from areas with hotspots will need to self-quarantine. Both are close to Louisiana, which has the second highest number of coronavirus deaths per capita.
Understand that executive orders that issue about travel is keenly focused on one main goal, and that is to reduce importing COVID-19 into the state of Texas.
FEMA tweeted photos of a shipment of protective equipment that landed in New York Sunday. The international shipment included more than 130,000 N95 face masks and nearly 2 million face masks and gowns.
And in addition to that protective equipment, leaders stress the best thing we can do for our healthcare workers is to stay home. Alan?
Elise, I saw earlier on my LinkedIn account that this happens to be National Doctors Day of all things, and I'm sure you've seen people there honoring the healthcare workers and what they're doing for the rest of us.
Yeah, all over. You can see an outpour of support on social media like we've seen since the very beginning of this pandemic. There was a really touching moment about an hour ago right outside here at this hospital, Mount Sinai. There was a shift change, and there was just this thunderous, loud, echoing round of applause and cheers. I thought that there was maybe a big crowd gathered, but it wasn't. That's just how loud people in the neighborhood were cheering for our healthcare workers as a way to say thank you to these people who are putting their safety aside to save others.